Hello, hello, hello. Welcome to Transformation Tuesday. I'm Dr. Troy Lee, holistic nutritionist and anti-aging expert. And today's topic on how to age well, live well, and be well is all about whole body inflammation. Now, normally I don't do a PowerPoint when I do these talks, but I thought this was one that needed a PowerPoint just to make sure I'm grabbing your attention with the key points. So let's get started on our topic of inflammation today. And please remember to subscribe to my channel. You can click the button below. It's down there somewhere because I do drop a new video every single Tuesday on Transformation Tuesday to help you live a better and healthier life. So again, today's topic is all about inflammation. And as you can see from the slide I already have pulled up here, this Time magazine cover is at least, I think it dates back to 2004. I think that's when I first found it. But notice what it says, the secret killer, the surprising link between inflammation and heart attacks, cancer, Alzheimer's, and other diseases. And folks, I don't know about you, but that doesn't sound like anything that we want to sign up for. But yet, most people have never heard of whole body inflammation. They don't even know that it exists. And what's even worse, they don't even know that there's a simple blood test that can determine how much inflammation is in your body. And there are things that you can do to get that number down. So some doctors believe that inflammation is at the root of most diseases, and science has proven that. And again, this is a topic that most people aren't even aware of. So what are we looking at with inflammation? Now, folks, inflammation is a normal part of the inflammation response is part of your immune system. So if you were to cut your finger, your immune system goes into action. It sends its foot soldiers in there, which are inflammatory cells and cytokines, and they will help to heal that injury. That's what they're supposed to do. However, if there's no injury and these inflammatory cells and cytokines keep marching, that leads to whole body chronic inflammation. And that's where you get into trouble. That's where our bodies are totally out of balance. I'm sure you've heard of autoimmune diseases. So that means the immune system is not doing what it should be doing, it's out of whack. And that's the same thing with whole body inflammation. Your immune system is doing something that it should not be doing. And often it is in response to something that you are doing or something you shouldn't be doing regarding diet, exercise, and lifestyle. So look at all the disorders that inflammation is related to. Let's start with cardiovascular disease, the number one killer among us, including women, especially for women. That is the number one killer of women is cardiovascular disease, allergies, eye disorders, asthma, diabetes, colitis and Crohn's disease, infection, injury, psoriasis, obesity, arthritis and joint pain, lung cancer, breast cancer. All of these diseases are related to whole body inflammation. So pick one. Are you signing up for any of these? Absolutely not. So let's get that inflammation down, right? So what causes whole body inflammation? A couple of things. Exposure to toxins like pollution or industrial chemicals. And folks, we have pollution all around us. Our water is polluted, our air is polluted. Even our homes have high level of pollution, especially if you have down synthetic materials like, carpeting. It could come from your furniture, upholstery, and there is even some wood floors that has proven to be toxic if they are made with certain chemical glues to hold them together, etc. So you really can't avoid toxins, and you should be doing something regularly to detox your body. That's another video, of course. Untreated acute inflammation, such as if you've had an injury or an infection that hasn't gone to be treated properly, then this could kick off whole body inflammation as well. A poor diet. Folks, you are what you eat. So you need to have a healthy diet so you can tamp down this inflammation in your body. Drinking alcohol in excess, a nightly cocktail is okay, but are you drinking it excessively? If you're overweight, you know your weight, you know whether or not you need to lose weight. And we just can't say, well, I'm a big girl. Folks, overweight is overweight, and not everybody should be a size 2 or 0. I get that, but if you're overweight and you need to shed some pounds. Lack of exercise or too much exercise. And so if you're not exercising, that means your body isn't doing the things it can do, it should be doing to be healthy. And if you're exercising too much and not putting in the proper nutrition, that can also lead to whole body inflammation. Chronic stress. So if you're under stress from your job or your work life or your home life and something's not in balance, chronic stress can cause inflammation as well. And we have smoking. You already know smoking is not good for you, so I'm not going to spend a lot of time on that one. But all of these things can contribute to whole body inflammation. And our topic last week was what? Sleep. So lack of sleep can drive your cortisol levels up. It increases the inflammation in your body, and you just got to go to sleep. You got to find a way to get some good sleep in. And I'm still studying sleep, so I may do another video about that as well. Okay, so how do you know if your inflammation levels are too high? Well, there's a simple blood test, folks, and you can get this blood test done whenever they draw your blood for your cholesterol and your sugar levels, etc. Regular blood test. All you have to do is check it on the lab chart. However, most doctors do not test for this. Some doctors don't even believe in the number. I don't know why with all the research out. But folks, all you have to do is ask for a basic C-reactive protein test. Now, your doctor may look up and warn you, well, your insurance company might not pay for this. Folks, the test is going to cost about 35 bucks, but is it worth it to know whether or not you have this chronic condition in your body or not? Is that worth it to you? Because if you have it, you definitely want to begin to work on it. Just like if your cholesterol is high, they're going to try to zap you with a statin immediately. Well, folks, if this number is high, you should jump into action to do something about it. So you definitely need to know about it. Now, here's some key facts about C-reactive protein levels. The higher the CRP level, the more inflammation in your body. It's not specific to one disease. So we don't know whether you have a high C-reactive protein level, whether that's cancer, whether that's heart disease, whether that's something else going on. It just indicates that your body is on fire. It's inflamed, and there's a reason why it's inflamed. And these tests can help monitor your progression. So if something is flaring up, I get my C-reactive protein test done every time I get my blood work done, which is every 6 months. And I hear the same story, but I look at that number to make sure it's within acceptable ranges. Now, here are some levels of CRP. The optimum is below 0.65. That's optimal. But if you have it no higher than 2, that's desirable. If it's up to 3, that puts you at moderate risk, okay? Anything over 3 is high risk. The higher the number, the higher you are setting your body up for some of these diseases. So get your C-reactive protein level checked as soon as you can so you know what's going on in your body. So how do we get that number down? Folks, you got to clean up your diet. We need to adopt, rather than fast food, we need slow food. We need to be eating food that we are cooking at home so our bodies can get the proper nutrition. So we already have challenges with our fruits and vegetables not being as fresh as they could be. They are coming from overseas. We don't know the standards upon which they're raised. I understand that. But you know that fast food, pizzas, fried foods, you already know that stuff is not good for you. Can you have it every blue moon? Notice I didn't say once a week, right? But can you have it on a rare occasion? Sure you can. But folks, as a standard part of your diet, if it's nuggets and lots of cheese and nachos and all the stuff you see here, it's just not a good diet. So you need to clean up your diet and eat better. And what does eating better look like? You start with fruits and vegetables. Fruits and vegetables should be the stars on your plate every single day, every single night, every time you eat. You should be eating some fruits and vegetables along with your meal. You got to cut back on on the refined foods, the processed food. Folks, if it comes in a box, you probably don't need to eat it, okay? Definitely you got to cut back on processed foods like salami, bologna, ham, processed lunch meats. All of those contain nitrates and nitrites, and they have been shown to increase your levels of inflammation in your body. So I know you love bacon, but maybe save that, for Sunday, one strip, right? Just so you can get the taste. Bacon is good, I know, but it's not part of a healthy diet. Folks, you can still eat meat, but it needs to be lean meats. It shouldn't be the processed meats. It shouldn't be meats that you're finding, in the deli section or in the can. Eat lean meats. Those are absolutely good for you. You can have butter, you can have cheese, but have that, of course, in moderation. But folks, you need to eat real food. If it's processed, it's going to contribute to inflammation in your body. So that's how you get that C-reactive protein level down. That's how you get the inflammation down in your body. You have to eat better. Now, is there a cheat to get that inflammation down? Of course, guys, I always have a cheat, right? So let me just show you what Okay, I want to stop this share. Okay, so last week I talked to you about this wonderful company named LifeWave. Folks, they have a whole series of patches that you can wear on your body. These are non-transdermal patches, meaning there's no medication on it, there's no substance on it, nothing is going into your body. So a nicotine patch or a birth control patch, they have medicine on it. And when you stick it on your body, then that's a transdermal patch. That medicine goes into your body. Folks, these are non-transdermal. There's nothing on the back of this patch, nothing at all. As a matter of fact, the FDA has declared it a class 1 medical device, which is just like a bandage because that's what it's like. So this particular patch is called Why Age Eon patch. I love why age part because they're saying, why should you be aging when there's so many things that can help you slow down and even reverse the aging process? So folks, this little patch is for whole body inflammation. And these patches work on the concept of phototherapy, just like when you go out in the sun and vitamin D hits your, the sun hits your skin and your body makes vitamin D. Well, inside this little patch is a little crystal lattice. You can kind of see it there in the center. See what that looks like? Let me just take this off real quick so I can show it to you. Okay, so that's what it looks like. And that little thing in the center is made of amino acids, sugars, and salt. And that is using nanotechnology to create a very special lattice design inside of there. It's not crystals like you would buy from a new age store. No, it's just the formation of the lattice. And when you stick this wonderful thing on your body, okay, it uses the heat from your body, the infrared heat, to drive light waves back into your body, just like the sun. And when you put this on certain acupressure points for the Eon patch, you either put it behind your neck, you can put it below your belly button, you can put it on the top of your foot. Guess what it does? It fights whole body inflammation. So ladies and gentlemen, I wear this patch every single day. I just, move it around on my body, but I want to keep my inflammation as low as possible. And knowing that just living in this world, inflammation is going to come. This is a patch that I use every single day. How do I know it tamps down inflammation? One, the clinical studies prove that those inflammation markers go down in the body, and the results people are getting: less joint pain, allergies are starting to clear up, acne is starting to clear up, lots of things are starting to clear up in their body, skin conditions are starting to clear up. So folks, this will fight inflammation 24/7. You don't have to worry about taking anything. You don't have to worry about, did I forget to take it this morning? No, wake up after you shower, you leave it on for 12 hours, take it off before you go to bed. The next day you put on a fresh one. So this is my cheat for whole body inflammation. While I do eat well, yes, I do. And while I do drink my water and try to get the right amount of sleep, this little patch will tamp down inflammation in your body, and you can get some amazing health results when you begin to tamp down inflammation. So folks, that's our topic for today: whole body inflammation. Get that C-reactive protein test done, start eating better, and definitely you want to wear this little patch every day so you can keep inflammation at bay. Okay, hope that helps. See you next week, where we will be tackling a new topic to help you live well, age well, and be well. Dr. Troy Lee signing off on this Tuesday. See you next week. Goodbye.